I was here for my annual mammogram this past Monday, and they called me on Tuesday and said they found something suspicious.
Judy Buss is a breast cancer survivor who just found out she's in for round 2. She got results from CDI within 24 hours of her mammogram and was meeting with a breast surgeon just a few days later.
Something we do, I think, very special here at the center. Anytime a woman has a screening mammogram, if it's red abnormal, which in our hands are about 7 to 8% of the patients are going to be red abnormal, we have our technologist personally call each of those patients.
If there's a red flag on your mammogram, you'll get a call. CDI does not leave voicemail. We do not call you on a Friday, leaving you to worry over the weekend. A technologist is on the line with you to deliver the news and answer your questions.
I think by personally calling them and getting them back as soon as possible, it really relieves a lot of their fears.
You hear that you need to have something else done, and then they said biopsy, and in my mind instantly went to, oh my gosh, I have cancer.
Andrea Alm is like most breast patients. When she got the call back after her mammo, she couldn't help but think the worst. However, the first thing to remember is the vast majority of callbacks turn out to be nothing.
We may call women back for a finding that ends up not being a breast cancer, and unfortunately that does cause a little bit of anxiety. On the off chance that it is a breast cancer, where 3 times out of 4 it's not, for that one woman we made a difference.
If more tests show cause for concern, CDI will work with your referring provider to determine the best plan for you. This plan may include additional imaging, a biopsy, or even meeting with a breast surgeon like Dr. Nanette Wendell.
Generally, they are sky high on the emotional spectrum by the time they see me. So it's very difficult for both of us, actually, because I feel I need to give them a great deal of information in what I call a relatively short period of time. It's usually about an hour, and they're fairly overwhelmed.
If you get to the point of meeting with a surgeon, your second step is to write down your questions. Judy knows from experience.
I think you ask questions as you think about them, so keep a list, make a note, so when you take them in, you do have something to go by.
Your surgeon expects a lot of questions. Dr. Wendell says in between every operation, she's on her cell phone returning calls and answering email.
It's at least 70% of my day.
Step 3 in navigating a breast cancer diagnosis is to bring backup.
And it's almost like you need someone with you when you get that kind of news, because your brain just stops. You hear that word biopsy or you hear the word cancer, and you need somebody else to listen to the rest of the conversation for you.
Andrea brought friends to her appointments and had them take notes for her. The 4th step is to stay off Google.
This day and age, our natural instinct is the minute we hear anything, we go to the internet. And there's a lot of good information on the internet, and there's a lot of bad information on the internet.
If you can't stop searching, Dr. Wendell recommends these reliable sources: breastcancer.org, the National Comprehensive Cancer Network, and the American Society of Breast Surgeons. And if you do get that troubling call, keep in mind your mammogram was a success. The goal with breast cancer is always early detection.
So, yeah, it takes a while to get your head wrapped around it, but the panic has subsided, and I have a great husband and a great family and have faith in God, so we'll see.